For some reason I've lost you.
I see you.
Hey,
You see me?
no. Now I do. Okay, we're good.
We are live.
Hi, everyone.
Hello, everyone, and welcome to our Facebook Live. We are going to be discussing optimizing women's sexual health. My name is Jill Foose. I am your host for the evening. I am an integrative nutrition and functional medicine health coach located in Chicago. And I am here with a special guest tonight. Her name is Dr. Josie Tenore, who is an MD originally from Toronto. And I am so excited to share Dr. Josie with all of you, one of my favorite MDs on the planet. She's a board certified family physician who completed her medical training at the University of Toronto in '84 and opted for a career in family medicine because she enjoyed the challenge of delivering comprehensive health and well-being to people of all ages. Dr. Tenore practiced full family medicine, including caring for pregnant women and delivering babies. Never satisfied with the status quo when it came to her education, she earned a Master of Science degree in maternal child health from Harvard in '98 and worked with world-renowned specialists offering state-of-the-art medical care to her patients. She became interested in aesthetics during medical school and spent much of her elective time studying dermatology and plastic surgery. Dr. Tenore has taught at the medical schools at the University of Toronto, Brown University, and Northwestern here in Evanston, and has been practicing in the North Shore of Chicago since '98. She founded Fresh Skin Medical Spa and Wellness Center in 2010, which is located in Highland Park, a suburb of Chicago, and has continued her education to achieve board certification in management medicine with Age Medicine Management Group. That is a mouthful, and I want you all.
Holy moly. And good for you that you did it.
And I just want to tell everyone that Dr. Josie is all that times about 1,000. So that is a very modest description of Dr. Josie. So welcome, Dr. Josie. I call her Dr. Josie. We've known
Everybody does. Yeah.
Welcome.
Thank you. Thank you. This is so much fun.
Yes.
Yeah.
So tonight
I realize it's hump day. So it really kind of fits.
Yeah, right?
Topic, right? It's hump day. So
yes. So I'm here tonight to discuss a very intimate topic on women's sexual health. And we're going to go through hormone balance, blood work, the different life stages that women face, why it's important to orgasm on a regular basis, with or without a partner. And of course, during COVID, many of us are without partners, health benefits and the longevity of regular sex, sex toys and masturbation, sexual enhancement modalities, and more. We're also going to look at lifestyle hacks to support all of this optimization. You can't do it without a healthy lifestyle. So sex is so...
You realize that all of that is a mini series.
Right?
Yeah, right. We're going to be at this a long time, right?
And we're going to try to shove a lot of information your way in about 45 minutes. I'm sure we're going to go over on that. And I do want to mention to everybody that we are coming live from Zoom through Facebook. So if you are writing down any comments, questions, or any information you want us to see, I'm not going to see that until we're done, but I will look at everything and answer any questions or concerns you have, or point you in the direction of Dr. Josie as well. So to start with, sex is just, not only is it so much, it can be so much fun and should be so much fun, but it's so beneficial to our overall health and well-being. It activates different neurotransmitters that impact not only our brains, but several organs in our body. And every day as a woman, we wake up and we have to hop on a new emotional, hormonal, physical, and mental roller coaster ride that we didn't choose to go on. And it differs every day, and it is definitely there, and it is real. Some of the benefits of sex for women include lowering blood pressure, stronger immune system, super important right now, better heart health, improve self-esteem, decrease depression and anxiety, increase libido. And by the way, the more sex you have, the better off your libido is. And the more sex you have, the better off your vagina is in terms of self-lubrication. Better sleep, increase intimacy and closeness with your sexual partner. And it's the best stress reducer on the planet. And it's, kind of sad that stress is probably the number one killer of our libido and our sex life. So Dr. Josie, I'm just going to dive in here. How are we supposed to stay on top of all of this as women? How do we stay optimized through all of these changes and all of this aging? Where do we start? What do we do? How do we know there's something wrong?
Well, I mean, the first place to start is to, find an appropriate provider that you trust and who you feel really has your best interest at heart, and who's going to actually look at a lot of your biochemical markers. This is what we call blood tests. Blood tests is one of a whole host or a whole list of markers. And we use them to guide us, and then I in my practice, I also use a lot of surveys, because that's the only way that I can get your body to communicate with me. And then I use a combination of the communication tools you give me through a survey plus some blood work. And then I try to kind of put the two together to figure out where you should be in terms of optimum health. So, a lot of internists and family doctors and primary care providers, they'll do a basic panel. And, I see this day in, day out. People come in and say, I feel like crap. We're live, so I'm not going to say other words, but I don't feel well. And yet I went to my doctor and he said, everything's fine. And so we don't just look at your basic 1, 2, 3, 4 blood work. We actually go much deeper and we look at different components. Thyroid, we look at all of the different variables of thyroid out there. And with hormones, we look at, where you're at. And then, I mean, it would be great if I could take a snippet of everybody's blood work when they're like 18 or 19 years old and put some kind of catheter in them and monitor their hormone levels throughout their entire month. And then I'd say, okay, for this particular individual, this is what their hormones should be, because this is when they were like the healthiest. Well, we can't really do that. So we use the combination of blood work and the surveys. And we try to find a medium, and sometimes we have to replace some hormones, and sometimes we have to do, like you said, some body hacks or some nutritional hacks to try to augment your own body's ability to increase your own hormones. Now, go ahead.
So that's a great segue into talking about blood work. And I just want to throw this in there real quick. I want to talk about the difference between an allopathic physician and a functional medicine physician. So both are MDs, but an allopathic doctor is like your internist, your OBGYN, a regular doctor, right? What we think is a regular doctor. And then the functional medicine MD is also an MD, a real doctor, right? But it has a different approach, a different vision of the whole picture of the person and looking and taking a deeper dive into blood work. So when you're talking about blood work, for example, when you go to your OBGYN and they look at your thyroid or they look at your sex hormones, for your thyroid, they might look at your T4, right? They might not even look at your T3. They might just look at your T4. They
look at your TSH. That's it.
Right. There are, in some might go a little bit deeper, but most likely they're not. And when they look at your sex hormones, I don't think any of my OBGYNs in the past have ever even looked at testosterone. If you go in there and you say you're feeling fatigued, you're feeling a little depressed, testosterone is responsible for your zest for life. That's what gives us our oomph in life, right? And a lot of times, misdiagnosed as anxiety and depression. So what does an allopathic doctor most likely do when a woman like that walks into their office? Prescribes antidepressants. Exactly, which are not going to help out your libido and your overall sexual health. So when you're talking about sex hormones, and especially like the thyroid, it's sort of the master control system for your body, how would you describe normal ranges from an allopathic doctor versus optimal ranges for an individual from a functional medicine MD?
So, a normal range is basically, we don't even use that term anymore. They're now using the term reference range. So a reference range is a number. It's a scale between whatever number and whatever other number. And if you fall somewhere in that range, then you're considered normal. Now, here's where it gets interesting. What years ago, when the population was younger, the reference range had hormone levels and thyroid levels that were higher. Now that the population's aged, you can see where I'm going with this, right? So the population's older. And so if you pool a bunch of blood tests in an older population, their hormone levels and their thyroid levels are going to be much lower. And so you may be normal for a 50-year-old or a 60-year-old or a 70 or an 80, but that doesn't mean that you're going to feel good. And that doesn't mean that it's where it would be an optimal range for you. And so an allopathic doctor just sort of says, okay, your blood work is within that reference range, you're good. Take this antidepressant, take this anti-anxiety medication, hey, it's normal, you're aging. Whereas a functional medicine doctor will say, well, we know from having collected data from hundreds of thousands, actually millions of people, that a particular number or a different range is actually more, it's a more functionally appropriate range, and it's associated with much better health. So I often will draw, like on a graph, that normal distribution curve, and I'll say, well, you can be here on the lower end or up here. So you can function like a 90-year-old or you can function like a 20-year-old. Where do you want to be? And so we kind of try to get people to be more optimal in their health, as opposed to just falling in this range that is appropriate for their age group, which is really not necessarily good quality of life. So we look at quality of life and really focus on that.
Right. And, it's, as a health coach, when I have especially a middle-aged woman come to me, which I am one of them, and we're either peri-menopause, menopause, or we're post-menopausal, we have a lot of fluctuations in our hormone and we don't feel that great. And I want all of the ladies watching this to understand this is a process. This is not an overnight ordeal. There is no magic pill, because once you get one number optimized, it might have a negative impact on other numbers. So there's a dance with all these numbers, and at some point they do click, and we're going to go into the different sexual enhancement modalities that will help support getting everything balanced. But this is not a quick fix. This is, as I know, as one of your patients, this is a lengthy process that requires commitment to a healthy lifestyle, commitment to possibly taking supplements. It's a commitment to being patient with yourself and practicing self-love. And I think that's really important, because there's not a magic elixir for this at all. I have a question regarding blood work. When someone is on birth control pill, or they have a hormonal IUD, maybe they come in and they are taking a cocktail of antidepressants, anti-anxiety meds, ADHD meds. What is that? And here you are pulling a deep dive on their blood work. What's the impact of all of that coming in, and how do you compensate for that?
Well, I mean, often these cocktails that people are on is to deal with issues that may have been able to have been treated differently. But, this is what I get in. I mean, when I look at we take a fairly extensive history when people come in, and invariably it used to surprise me, but it doesn't anymore, that most women coming in are on a cocktail of antidepressants, anxiolytics, ADHD medication. It's like, oh my God. And then they're like, I have no libido and I can't get an orgasm. I'm like, well, hello. Of course not. You have all of these drugs that are really affecting your body in ways that doesn't allow it to work properly. So, we still, some hormone secreting medications, birth control pills, IUDs, do somewhat affect blood work, but not enough that we can't at least start the journey in terms of trying to get healthy. And I think a lot of my patients say, well, how long is this going to take? And I'm like, you gotta give me a year, folks. You gotta give me a year, because I would love to like hit it out of the ballpark and immediately have people feeling better. And every once in a while I do. I mean, every once in a while someone comes in, we tweak a few things, and they feel great. And that's like so exhilarating for me, and I'm sure for my patients. But for the most part, when I'm given this cocktail that I have to deal with, it takes a little while. And I always tell my patients, look, we got to do baby steps. And each little baby step, because if we make 20 changes, well, and you don't feel better, well, I don't know why. If we make 20 changes, you do feel better, I still don't know why. So it's better to sometimes do a little bit of change and then evaluate it, and then a little bit more. And then as long as you're patient, and as long as you can realize that there is a light at the end of the tunnel, then eventually what will happen is some of these other medications, which I consider background noise, can start to remove the background noise. And then we can start to see much more optimum health, much more, being in tune with your own body, and having, this sense of like mastery that, hey, this is me now. I'm not chemically altered in any way. And so, hear me roar. And so that's kind of the approach I take. So there's no way I stop all of that. I sort of chisel away, like Michelangelo would be like carving his marble, and we gradually add something, remove something else, add something, remove something else, until we get to the point where, I have people coming in where sometimes I don't even recognize them in my waiting room. And this is like pre-COVID, where, now I don't recognize anybody because they have masks, but pre-COVID, people would come in, I'd be like, holy cow, who is that person in my waiting room? And they are like just exuberant and wanting to share how well they feel. And that's really, kind of what rocks my world.
Right. And it's, before we move on to a different topic, I want to just mention cholesterol here, because you do a full cholesterol panel as well, the lipid panel. And a lot of women come in to me as a health coach and they're on statins. And I don't think so many of us out there realize that it's cholesterol that manufacture sex hormones.
Yeah.
And without cholesterol, we aren't going to have sex hormones. Every cell in our body needs a level of cholesterol. And statins also reduce our sexual function. They make us physically weak, and they also affect our mood changes. So there's a lot of negativity. And I truly believe that a lot of women that come to me most women come to me to lose weight. And then there's all these peripheral issues going on. But when you're on a cocktail, and especially a statin, it's really all of the cocktail. It's very difficult for women to lose weight and feel good about themselves. Their body isn't going to respond the way, and so they try to eat the best they can, and they still don't see any movement going on the scale. But we need cholesterol. We need to support all of the blood work, and this with a healthy lifestyle, which we're going to get into a little bit later. But anything you want to add about cholesterol?
So it is, cholesterol is essentially the building block for all our hormones. And so you're quite right. Often what happens is, as women age and their hormones drop, their cholesterol goes up. Well, because the body's response is to say, hey, I need to give you more tools because you got to make hormones, and then the body's not really making them. So often when we optimize hormones, cholesterol will naturally drop, because the body isn't on overdrive trying to make the building block that's needed in order to create the hormones that are also needed. So I don't really care about a cholesterol number. When I look at cholesterol panels, I don't care about the number. I care about, there are certain fat protein molecules that I look at. There are some genetic fat protein molecules that are important in terms of creating issues with arteries, but I look more at inflammation. So if your cholesterol is high and these other fat protein molecules are fine, and you're clearing more than you're accumulating and you have no inflammation, I don't care if your total cholesterol is 800. It doesn't that's meaningless. And I mean, the other thing is that when you look at primary prevention, there isn't a single study that I have been able to find that's been well done that has shown me that giving a woman a statin before a heart attack has really done anything in terms of impacting their health in a positive way. Right. So, a lot of people use it because they look at this number, it makes them anxious, and you see cholesterol number going down and the doctor's less anxious. But, I do have that conversation with patients, and we look at the markers that really matter as opposed to just your total cholesterol.
Right. Yeah. Okay. And so now we are going to move on to sexual enhancement modalities. So for those of you that have never heard this term before, these are procedures or therapies that will help men and women reach a more optimal sexual health state. So the first one I want to talk about is bioidentical hormone replacement therapy, which is different than hormone replacement therapy. And I think it's really important to hear from you what that difference is, and just what is bioidentical? Is it safe? A lot of women fear this, thinking it's going to give them cancer, but it's an amazing modality that we have in our back pocket.
So thank you for that. The number one killer of women is heart disease. It's not breast cancer. So we have a lot of women who come in and they're fearing breast cancer. And there was a study that was done back in the late 80s, early 90s, the Women's Health Initiative, where they followed a lot of nurses who were taking hormones. And they followed them, and there was all of these outcomes. And then they gave some of these women who were 10 years away from having been, 10 years out of menopause. They gave them these hormones, which were not bioidentical, and I'll get into that in just a sec. And they had heart attacks and strokes, and they stopped the study. And then panic ensued, and nobody wanted to take hormones anymore. And everyone was worried. So let's get to the difference between the hormones they used and bioidentical. So you can create something that looks like you, but isn't like you. So when I talk to patients about hormones, I say, okay, a bioidentical hormone is like if your hormone looks like a house, the hormone that's manufactured looks like exactly that same house. And so when you take it into your body can't tell the difference between what it naturally made when you were younger and what has been given to you. The hormones they used in this study were actually like a house with a chimney. Now, that chimney may have created some issues. And typically when you're looking at the hormones that women need in their body, thyroid, estrogen, progesterone, testosterone, none of these women were on testosterone. And in fact, we're just actually in the scientific allopathic community, they're just starting to look at what does testosterone actually do in women? And forget about women, they're just starting to look at it in mice. And so we are behind the 8 ball in terms of the allopathic world really understanding what testosterone does for women. So none of these women in that study were on testosterone. And so when you extract some of that data, it's missing a big piece of the puzzle. Like for instance, estrogen does activate breast tissue, but testosterone downregulates breast tissue. So there are studies that show women who are on testosterone therapy, they do an MRI of their breasts before being on testosterone. And then after, and the pre looks like breast cancer. It's all active. And then the post looks like it's nice and quiet, normal breast tissue. So, a bioidentical hormone is really something that is exactly like your own body makes. And so they're extremely well tolerated. The side effect profile is really more on, remember I told you, give me a year. Well, I don't know what your testosterone level is for you. There's a range I look at, but you may function better slightly on the higher range. Other people may function better a little bit on the lower range. that's all fine. But the side effects of bioidentical are more in terms of what that actual hormone would do in the natural body, as opposed to something like a progestin, which is in a lot of these hormone secreting IUDs. Well, progestins is what we used to give women to not have babies, Provera. And we'd give them a big shot and it would make them fat, bloated, hairy, moody, well, and no sex drive. I think that's probably why it worked for preventing pregnancy.
By the way.
Right, but progesterone, which is what your body makes, will actually improve your mood. You will not get bloating from it. You'll have better sleep. So that's really the difference between the two. And in the allopathic world, it's like, here's your dose, knock yourself out. And in the world of functional medicine doctors, we kind of look at, okay, well, I don't know what your dose is. We play around with that and we customize a particular dose more to you so that we can get you feeling the best that you can. And so that's really the difference between, commercially available drugs and then the bioidentical world. Does that make sense?
Totally. And so I want to just break down out of the testosterone, estrogen, and progesterone. We don't have time to dive into all of them, but let's just talk about the testosterone, because we get T pellets, right? And this is becoming more and more accepted and talked about, but I want the women listening to understand that there's different ways to get more T, which is going to help you feel better and help you lose weight, help you build more lean muscle mass, help you sleep better, help you feel more vibrant. And tell us a little bit about the pellets.
Okay, so there's, as you said, there's multiple ways to get testosterone. There's women who, want to try creams. And then there is, a method which has been around for the past 25, 30 years. They are small little pea-like, we'd use the term pellet. They look like a kernel of rice. And it's a little mini surgical procedure I do in the office where I make a little nick and I actually place it under the skin. And it sits there for several months, and that varies. For some people, it's 12 weeks, some people it's longer. But essentially what happens is that the testosterone is released in the body as the blood flows across the pellet. So the more active you are, you're going to get a little bit more testosterone, which makes complete sense physiologically, because think about, if you're out, think about caveman days. If you're out hunting and you're trying to find your enemy or hunt down your animal, you want more testosterone when you are activated and you have more blood flow. So it does work with the way that your body works. And I have to be honest, if I have two women and I've got one that are using creams, because oral testosterone doesn't do well with lipids. It creates unhealthy lipid profiles, and it's not really recommended. So you've got topical, injectable testosterone or pellets. And in women, most women, we never give them injectable. But if I have a person who is using the creams versus a person who is having pellet therapy, I have to tell you, my pellet patients just feel better. They tell me that their libido's better, they sleep better, their mood is better. And the only explanation I can give is when you put a pellet in, your blood level goes up and it stays up. And then just as it starts to fall down, we put in another pellet and it goes up. Well, with creams, one day you're sweating too much and you don't absorb, and another day you absorb too much. And so when you have this kind of blood level, it plays a little bit of havoc with you. But that's not to say that there aren't women who do extremely well on creams. They do, which is why I offer different modalities. But when people talk about pellets, that's really what they are. It's just a method of being able to get a more sustained amount of testosterone in your system that allows you to kind of function. And the more active you are, the more you get a little surge, and it just works a little bit better physiologically.
And so for some of you ladies out there who don't know about the pellets and are just learning, there's really hardly any downtime. You go in, it takes all of 10 minutes. They're usually placed in the side of your tush. just subcutaneously. And you can walk for the next 2 days, but you can't do any like sort of weight training or any heavy duty lower body exercising or yoga, because you don't want to push them out. You don't need any stitches. It's super tiny. So very little downtime, maybe a little bit of a bruise or soreness, but nothing worth avoiding it for. The next modality I want to talk about is super interesting, the vaginal rejuvenation and the PRP, the O shot. So I believe one of the first women we heard about doing this many, years and years ago was Kim Kardashian, or one of the Kardashians, I think. And so vaginal rejuvenation, there's also vaginal reconstructive surgery. We're not going to dive into that at all because that's a huge conversation, but vaginal rejuvenation is really incredible. And I want you to talk a little bit about that.
So I want every woman, as soon as she's had a baby and they've recovered the 6 to 8 week period, pop into my office, get a treatment done, because the more we can keep that area healthy and vibrant, the better. So that's just like, my public service announcement. But vaginal rejuvenation has become kind of like this trendy term. And what the technology, there's probably, I think when I purchased the device that I have in my office, which is called the Viviv, I did this entire spreadsheet and I looked at 14 devices. And I was looking at, the number of treatments that were required and what they did and what was the purpose of it and, the technology cost and downtime. And there was a number of them where I just went, what? Like resurfacing the vagina. I'm like, this is about the only place in the body you want wrinkles, because the whole point is that you want those rugae. So I ended up settling on a device called a Viviv. And what that does is it delivers very deep heat to the deeper tissues in the pelvic floor. So as we get, for whatever reason, it's not just aging, because, when I was doing my research, I think one of the reasons I really wanted to have a device was because I heard these 14-year-old basketball players, I think my boyfriend's daughter said, isn't it normal to go to the bathroom and put paper towel in your underwear in the middle of the day? I'm like, no, why are you doing that? Well, high schoolers will get leakage, bladder leakage, just from the impact of their sports. So you can get bladder issues and you can get vaginal looseness and vaginal issues. And so in order to strengthen those muscles, we need to do something that's going to revitalize the collagen and maybe stimulate some of the muscle action. And so this device, that's what it does. And it allows us to really deliver the energy much deeper, because the handpiece that I use, or the tip that I use, has a cooling plate on it. And so a woman's very comfortable having it done. And the energy is really, really, really focused deeply. And I do a little extra at the G spot, because of course I want better orgasm for all you women out there. And so I'm able to kind of do that. And there's zero downtime. In my post, I say, refrain from having intercourse, but sometimes I wonder why, because there's really no downtime at all. And within a couple of weeks, women will report that, their husbands or boyfriends are kind of like, what'd you do down there? It was a little tighter, and women will say that they're lubricating better, the quality of their orgasm is better. If they do have bladder leakage, that takes a longer period of time, because it's, takes a long time. It takes about 3 months for all that collagen to kind of knit together and to create new collagen. But essentially, that's what we're doing. We are body hacking in a way. We're providing energy to allow the body to create brand new collagen, to heal old collagen, and to tighten everything up, and to revitalize some of those tissues that haven't had exposure to, either hormones, or they've had sort of the impact of everyday living, walking, jumping, pregnancy, and that sort of thing. And it's not vaginal deliveries. You can develop bladder and vaginal issues because, when you're pregnant, and I think you've been pregnant a couple of times.
Oh yeah.
Yeah, there's this, golf ball. Well, it's bigger. It's a watermelon sitting on the pelvic floor, bowling ball sitting there, just pressing on it. And it's the pressure much more than the vaginal delivery. So I even have, patients who have had cesarean sections still have these issues. So it's a wonderful device. It works. The Viviv is great because it's one treatment. We do recommend a maintenance treatment once a year, just because everything that hits that area, we can't take that away. But normally when my patients come in annually for a bit, I start to notice that there's a spacing of their treatment. So it's not exactly a year. Sometimes we can stretch it out 15, 18 months, but usually it is something that is extremely helpful, and boyfriends, husbands like it.
Absolutely. And I want the women to think of it as a vaginal facial.
Yes.
So all this money to be beautiful on our face and to stimulate more collagen and do all these laser treatments and derma fillers and all this stuff, right? Well, we want our vaginas to look just as beautiful and supple and youthful. And this is an amazing modality. There is zero pain involved at all. I will admit that I have had them and I absolutely love them. I have had 5 children. It's just been a lifesaver to my sex life. And there is zero downtime at all. There's no numbing ointment needed at all. You can have a full-blown awesome conversation with Dr. Josie. You could, answer your emails, be on the phone. You could, if she had a tray, you could actually bring your laptop and do some work there. It takes about 40 minutes to an hour, right? So super easy. It is expensive, and it is definitely none of these modalities are covered by insurance. So it is expensive. It runs, somewhere between $1,500 and I would say $2,800, depending on where you live in the country and who you're going to. Let's talk about the O shot, because the O shot is something that you do while you're doing the Viviv treatment. And this is used with PRP, which is using your own blood to extract the plasma. And then it is shot back into your clitoris. And this is to help you achieve a greater sense of orgasm. A lot of women have lost, lose over time the feeling in their clitoris, and nobody wants that. We all want that to be front and center. So tell us a little bit about the PRP O shot.
So O shot stands for orgasm shot. So that's what that is. So the anatomy of the female body is really, a little bit kind of like the male. The clitoris is like the tip of a male penis. And there is, these little arms on either side that also are very important. And it's similar to what a male penis is. And as you say, we take a sample of your blood, and then we let it sit for a bit so that it clots. And then we spin out the red cells and the white cells. And what we're left with is platelet-rich plasma. So that's what PRP stands for. And I think you alluded to the Kardashians, because I think the Kardashian was also the first who had like a vampire facial. Same thing. We're using your own blood and we're extracting these growth factors. So what is found in it's sort of an orangey, yellowy, clear liquid that's left. And what's in there is a ton of growth factors. And when we place these in an area that has collagen, elastin, and every other fiber that is required, it sort of looks at that and says, oh, I want to be a little bit more collagen. I want to be a little bit more of these nerve tissues that make sensation, and I want to turn into that. So we are essentially giving the body an opportunity to take these growth factors, and they're not exactly stem cells, because that's a little bit different, but it's similar to the concept of stem cells. And your body will then make more collagen, make more elastin, make the nerves a little bit more sensitive, plump everything up. And so therefore, a couple weeks later, you're going to start noticing an improvement in, the quality of your sensation, the quality of your orgasm, and it really is helpful. So, this is one area where we do numb, and I've spent hours trying to, every time I do something, I'm like, how can I make this better and like safer and easier and more well tolerated by women? And so, I do numb the area with a topical cream. And then beyond that, I use a tiny, tiny, tiny needle, and I go in around all of the area that is sensitive and that you want to be sensitive for orgasms. And it does a great job in rejuvenating. I typically tell women that it's not one and done. So I'll have them come back at 6 weeks, and then they may need a second. Some women might need a third, but it's not unusual for me to have somebody who had, if you look at the best orgasm you ever had in your life being a 10 and like being a 0. I've taken women from 0 to 5, which is like 100% improvement with one O shot. So to get them to beyond that, it's just really quite amazing. And so it is something that's fairly easy and well tolerated. And there's, there might be a little tiny bit of soreness and there might be a little bit of bruising because I do use these tiny, tiny needles. But other than that, after a day, you ice it and you go on your way, and it really is fairly well tolerated. And a lot of women do like it.
Yeah, I would say you might not want to jump on the Peloton that day, or maybe even the next day, take a couple of days off. But yeah, both such incredible things. And the more we talk about these things, the more we get more comfortable with this conversation, the more normal it is, the less anxiety us women have to have about empowering ourselves and mapping out our own sexual health. It's defined by what we want it to be defined by, which is pure pleasure. And we're going to get into sex toys. So I want people to remember the O-shot conversation for when we get to the sex toys, because I'm going to sort of wind them all together. The next modality or therapy is peptide therapy. And this is really cool. I talked about this with Dr. Ryan Lombardo as well about men's sexual health, but it also works for women. And so the big buzz right now, and you and I had this discussion, and I'm excited to hear more, is about peptide 141, which is the hormone treatment that works to improve sexual function. But for women, it's focusing on sexual arousal disorder for women. And it's supposed to just, wind your libido up. And it's a shot, I believe, right? It's a shot.
You give yourself daily shots.
Yeah. And you can do them weekly. They don't, it's definitely something you need to do on a more regular basis. So tell us a little bit about that one. And I know there's another one you wanted to share with.
So, I looked at that. I was really excited about this. I don't know, maybe it was 3 or 4 years ago, because they were doing FDA studies for a product that actually is FDA approved and it is available. And it's FDA approved for hyposexual dysfunction disorder in pre-menopausal women. And I grabbed every article I could find, and I looked at the, some of the FDA publications. And, I was really, when I looked at the number of women, it does help people. Do not get me wrong. But when I looked at the numbers, it wasn't a wow for me. I still, I was able to get some during the study to try on some of my patients. And, I wasn't really wowed by it. However, that said, it doesn't mean it's not helpful. And it doesn't mean that if a patient comes to me and says, I really want to try this, I let them know what the costs are. I tell them how to use it if they have high blood pressure, or however, I don't recommend it because it can increase blood pressure. It can increase headaches and this sort of thing. But I still will offer it up because you know what? There is a small population of people that it does help. And it is intended to try to deal with this issue where there are women who just are born with, or they are victims of sexual abuse, which is usually what's gone on, where they don't really have any libido and they're not really even comfortable trying to get there, and they're with a partner who wants to have an intimate relationship and they're just not able to even feel anything. So that was really what the drug was intended. Of the peptide, we're really super excited about peptides because peptides do a lot of great things, and we use peptides in the practice. One of the peptides that I really think might be a little bit more promising is something called kiss peptide. So, of course, we already like the name because it involves kissing, but kiss peptide, it's, when they first looked at it, it's very much involved in fertility. So there's a gland in the brain called the hypothalamus, and it activates all of these, the hypothalamus, and it helps your own hormones become more, or the mechanism for you to produce your own hormones to be much more efficient. And so it will augment your own hormones. However, there are aspects that it will stimulate outside of the hypothalamus. And it's these, the outside the hypothalamus stimulation that seems to create a much better release of those chemicals that are involved in bonding and in pleasure and in that whatever we call libido. And so I think that kisspeptin, to me, I've seen a much better outcomes from that. But again, the P154, there's people, P150, 141, there are people who do get benefits, so I'm not going to ever withdraw it, but there are other peptides that might be helpful in the event that that one doesn't work. They're costly and they're not covered by insurance, but they're still worthwhile to try.
Yeah, so they're not covered by insurance. So what's the cost, average cost on peptide therapy? Weekly?
You know, it can be anywhere from $80 to $200 a month, depending on, you know, the person, the dose, the frequency, and all that sort of thing. So it's not cheap. Some of these can be used as a as needed basis. And you alluded to this earlier. The more you have sex, the more your libido improves. Like, it's not just you fix one thing and all of a sudden you're gonna have this great libido. You actually kind of have to use it in order to not lose it. And the more you exercise the libido, the more you're going to have libido. And there's a point that we hope that people are not going to be dependent on these modalities and that they're going to be able to just function without, you know, or maybe using them periodically to just kind of keep their youth up.
Right. Oh, and by the way, I wanted to mention the cost on the O shot for all of you, which runs about $500 a shot. So expensive. But again, these are things that work, they make a difference, and could be part of your wellness package if that's something that you're looking to include. Let's talk about acupuncture real quickly. I know acupuncture, I'm not, you know, I did acupuncture many, many years ago. I most recently had it this past week in the city, and I know it unblocks and creates space for energy flow throughout the body. But how does acupuncture support a woman's sexual health?
Well, acupuncture is great. It does a number of things, you know, and so it can help with augmenting whatever mechanism that's at play that will increase the production of your own natural hormones. It may increase blood flow because blood flow issues are a problem or can be part of the issue. It can cause relaxation. It can improve sleep, because sleep is deprivation is libido killer. It can improve mood. I mean, I can't say one thing that it does because it can affect so many aspects of the body. It's usually, you know, specific to the individual so that you can customize what needs to be done. And usually, I mean, I have the best acupuncturist on the planet who is the head of my wellness department, Ryan Lombardo. You interviewed him recently, but he would, you know, he'll sort of do a diagnostic and sort of figure out, are you running too hot? Are you running too cold? Do we need to, you know, warm you up? Do we need to cool you down? Do we need to get the meridians flowing better? So there's so many aspects that acupuncture helps. And I mean, years ago, I ended up, well, a lot of years ago, 1985, I was in Beijing, China, and I watched someone have a cesarean section under acupuncture. Wow. And this was before we even understood about the gate theory of pain. And I sat there going, there's no way this is placebo. And so I got actually interested, I got trained in it, and then it just became very difficult as an allopathic physician to actually do acupuncture. But to me, you know, it's really very amazing, and it's a great modality. And I think that if anyone can add that, it's just going to be additive, and it's going to be, you know, rebalancing and curative and just get things flowing better. And so I can't say anything negative about it.
I'm glad I asked the question. I really, you know, do not know that much about acupuncture, but definitely something to look deeper into. So before we get into lifestyle hacks to support all this yumminess, let's get into sex toys and masturbation. And
just in case we run out of time, we have to talk about sex toys and masturbation, right?
Yeah, we could do that for days. But especially during COVID, and now that we're entering into an even more strict COVID lockdown, and let's say you're single, or you could have a partner and still play with sex toys and masturbate. Absolutely. I actually refer to the sex toy collections that are being collected by people as the COVID collection. So
I mean, something coming out of this is positive.
The sex toy industry has like skyrocketed on its sales, but so here we are using these vibrators, pleasuring ourselves, and the key here is for women to pleasure ourselves. And I am all about knowing how to pleasure yourself so that you, when you do have a partner, or if you currently have a partner, you're able to communicate that with your partner and tell them exactly what it is that you want, that you desire, that you need to reach that orgasm and have the ultimate pleasure. Let's just talk about vibrators. There's a multiple sex toys out there for women, but vibrators, I believe, would be probably the most used. Do vibrators, when used very often, cause any kind of long-term permanent damage to, let's say, your clitoris? Most vibrators are used on the outside to stimulate your clitoris, to reach an orgasm, and there's a numbness that comes along with that.
Okay, so it's, like everything in life, it's complicated. If someone is rubbing something enough or vibrating something enough, or it can get a little bit desensitized. And so but I think it's a little bit more complicated than that, because women's lives are very busy, and I think that we didn't really talk about this earlier, in that, if you look at an average woman who works outside the home, or now it's all in the home because of COVID, but let's take COVID and forget that it exists. But you have a job, then you're a mom, and then you're a wife, and then you come home and you're doing 3 jobs, and you're exhausted. A lot of exhaustion is a libido killer. But let's say someone is able to have some kind of libido. I think the bigger issue with vibrators is that they're efficient, and it's sort of like gets the job done and then move on. And there are times when, women may have or may need a little bit more work. I talk about men being the light switch, on off. Women are like the remote control. There's like a million buttons and you got to push them all, and there's got to be different orders, and if you don't do it right, it doesn't really work. And there's a lot more going on. And I think a vibrator kind of bypasses some of that. And so women sometimes can orgasm more easily, and it's sort of like fast, modern, and efficient, and their lives are really, really constrained. And so I think some of it may have a little bit to do with just the efficiency of what a vibrator can do in terms of orgasm, as opposed to having a partner, and there's got to be touch, and you've got to have a mouth down there and the tongue that feels a certain way, and it's got to rub a certain way. With a vibrator, you can direct it. So while I do think there is a little bit of desensitization if you're using it 3-4, daily or multiple times a day, and just aging will cause a little bit of desensitization. But I don't think that it's a long-term, you're not creating immense damage that's irreparable. We can do treatments that will build that tissue up. And there are sometimes, as we get a little bit older and things are less sensitive, we use vibrators more because they're more efficient at being able to stimulate the nerve endings. Does that make sense?
It makes total sense, but let's back up to our previous conversation on the O shot and the vaginal rejuvenation treatments. Are we going to ruin that? Here we are spending all this money and time and energy into getting our vagina exactly where we want it, right? And then are we going to go ahead and ruin it using, battery operated toys?
I think that if if it's the only thing you're using and you don't have a partner, that's what you got. But if you do have a partner, it can be part of the relationship. It can be part of the sex play. It can be part of the whole sharing and exploring. So it's not going to necessarily negate what you've done and what you spent money on. But just recognize that over time, sometimes people blame these devices. if they're used as part of, sex play and they're not abused, because abusing anything is going to cause harm, not irreparable harm, but if it's part of the, what you do, I don't think that there's anything wrong with regular use of vibrators in a relationship, or even just self-pleasuring if that's where we're at in our lives with COVID, or just where we're at in terms of not being in a relationship.
Right.
Sex is still important, orgasm is still important.
Right. What about lubes? There's a lot of lubes out there on the market, and we ultimately we want our vagina producing our own lubrication, but that's not always possible, especially when we're on just in the beginning stages of this journey. And when I talk about lubes to some of my clients, I want them to use non-toxic, very healthy, clean products. And the reason being,
water based, so that it's not going to do anything that can't be washed off easily. Yeah, I agree.
We all know our skin is our largest organ, and everything we put on our skin gets immediately dumped into our bloodstream. And it's here we are trying to be on this health and wellness journey, including everything, right? And here we are putting on toxic lubricants topically on our vagina, and that gets into our bloodstream, causing more toxic load on us. And now we have to get to work again to remove the toxic load, which is then also at the same time going to diminish our libido and mess up our hormones that here we are trying to balance. So I want people to be really mindful about using non-toxic lubes, which are easy to find with Amazon.
Like everything that, I tell people, what you put in your mouth, read the labels, same thing. I mean, read the labels. And so water-based is usually, something is water-based, it's more than likely to be in the safer range than other things. So yeah, I agree.
Let's talk about the jade egg. And for those of you who don't know what the jade egg is, it's made from jade stone, and it's like a little egg shape. It comes in different sizes, and it helps women with Kegel exercises. So there's different ways of doing Kegel exercises, but do Kegel exercises really work? Are we supposed to really be doing these? How often? What's the whole deal with Kegels and the jade egg?
So we were talking about Viviv and how that works on strengthening a lot of the muscles, but there are muscles that are deeper in the pelvis that really, you need to exercise them just the way you do ab strengthening exercises, squats, and the rest of that. And so there's many ways to strengthen the pelvic floor. We in the allopathic world, we use the term Kegel exercises because it's something we can send to a physical therapist, and they have these devices where they can insert a probe inside the vagina, and it's attached to a little screen, and then you squeeze the muscles and you can see how forceful you are. And that's really the only way you know for sure how much you're able to really use those muscles and strengthen them. So Kegel exercises are important in order to keep the pelvic floor healthy, to keep the bladder lifted, to not have, leakage and that sort of thing. The jade egg is, I gotta love how many thousands of years of history where women have had these things and nobody ever knew about them. They're coming back now. Mm-hmm. They're basically used to put in the vagina, and you're supposed to squeeze the pelvic floor in order to keep it in there. Because if you walk around, it falls out, you're not strengthening your pelvic floor. So it is helpful. There are electronic devices that are also used. There's one called the Apex that does that for you. Because if you don't have something in the vagina where you can monitor how much you squeeze, sometimes you don't know whether you're doing the exercise properly. So the jade egg is one modality you can use to strengthen those muscles, having those, but there's Pilates that you can do and various other exercises that personal trainers can help you with that also strengthen the pelvic floor. Now, if somebody has a lot of incontinence, they usually need to see a professional to learn how to do it. But the jade egg is something it's ancient and doesn't involve electricity. So if the power is out, you could still do your exercises. And there's something to be said about the actual crystal. I mean, there's a lot of health benefits to a lot of different crystals. And so if someone gets benefit from certain types of crystals that aren't necessarily measurable, it doesn't matter, you know. It's so, and that's really what the jade egg is for, and what the uses are. And there's various other versions if somebody gets frustrated trying to hold this thing inside their vagina, it just doesn't want to stay.
Yeah, I've tried it, and it's time consuming, it's hard, it's frustrating, and I certainly don't want to be going to the grocery store with it inside of me either. So I wanted to talk about lifestyle, but we have been talking for an hour, and I think this lifestyle hacks to support women's sexual health and optimizing could be another great discussion we'll do on a Facebook Live. But
Right.
input on nutrition and exercise, stress management, sleep, things like that. But we'll do that another time. This was a great conversation.
Yeah, I enjoyed it too. Very fun.
Very fun. I hope that there are people watching and having multiple takeaways here, little snippets, and thinking about their own sexuality and where they are currently, where they want to be. And I would like to add that porn for women, there is zero shame in women enjoying porn. It's when porn becomes an addiction that I think there's a problem with anybody out there watching it. But like I said before, the more we have these discussions, the more we share with our girlfriends, with our mothers, with our daughters. God knows I talk about all this with my daughter. She's hopefully watching this and has a big smile on her face. But anything out there that is going to enhance a woman's pleasure during sex is awesome, and it personal, and also worth sharing to help someone else think about themselves and feel a sense of motivation. But I want to thank you for joining me on this journey. And if you are out there watching and you're interested in hearing more in-depth details about any of the topics we covered or a topic we haven't covered, please, you can direct message me. You can send me a email through my website. You can leave a comment in Facebook. And I'm also on this Facebook Live going to leave Dr. Josie Tenore's contact information at Fresh Skin in Highland Park. Obviously, with the way COVID is now, if you are out of state and watching this and would like a consultation with Dr. Josie and even having blood work done, it is all possible. So do not hesitate to contact her if you're not in Highland Park. And let's see, next week on Wednesday, Fresh Skin is having an open house, and it's all virtual. So I'm going to put some information and a link to that as well. I think it's going to be really cool. I'm actually going to be doing a cooking demo on Wednesday at 12:30 from my own kitchen. Haven't decided what I'm doing, but for sure it's going to be something that is going to get you in the mood, whether you're alone or with somebody, but for sure it's going to have some kind of aphrodisiac effect to it. But thank you again, Dr. Josie. It was such a pleasure.
And pleasure.
Yeah. And all right. So everyone out there, I hope you enjoyed this. Stay tuned for more Facebook Lives coming to you. And everyone have a great night. Bye-bye.
Good night.